Hello, everybody. Thank you once again for joining with us. And today I have Dr. Sunari Senaratne, who is a member of Marg Institute and has been working with us very closely during this past couple of years. Just an introduction about Dr. Sunari. She has a BA honors in social anthropology from the University of Sussex and MSc in anthropology and development studies from London. Is that London University? Am I right, Sunari?
Yes, that's correct.
And you did your PhD in disaster studies, once again from London School of Economics. And I got the
no, the PhD was from SOAS at University of London.
University of London, right? Okay.
Yeah,
so
right.
your special interest, your special interest is in disaster studies and also social and political aspects of agriculture.
Yes.
So I think it is a very opportune time for me to get in touch with you on Zoom to ask a couple of questions. Without further ado, can I start with the interview, Sunari? Are you okay?
Yes. Shall I? So, Amma, thanks very much for having me. It's a pleasure to be here. You have sent me two questions.
That's right. Yeah.
And I would like to start with the first one.
You want to start with the social aspects, that part, where I asked you how, Singapore, Taiwan, and South Korea have managed COVID.
Yes, and China.
Yeah, and China. And asking whether, what parallels do you see? I mean, of course, socially and economically, they are much developed, but also there is this aspect of people being more disciplined, right? So So
I'm leaving the economics to the economists, so I focus far more on the social and political aspects.
Okay.
So if you look at these countries we've mentioned, China, South Korea, and so on, they have dealt with this crisis and stemmed the tide of the pandemic, both by the deployment of a vast array of resources, which obviously they have, but interestingly, also the use of a particular technology, an app, which I think has played a big role in screening, isolation, contact tracing, and testing. And this has also happened in the context of a directed economy and a complex series of historical factors which have led to these countries being the types of societies that they are. So if you contrast China in that sense with a country like the US, you can identify several features which have made the very interventionist role played by the state in China impossible in the US. The US, for instance, they have a very aggressive form of capitalism with a very small nod to welfare. And it's buttressed by a series of social behaviors where the emphasis is very much on individualism and civil liberties. Again, to be contrasted with China. So this is why in the US, for instance, the government has found it very difficult to implement measures such as social distancing, vital from a health point of view, and why there are protests against the curtailment of civil liberties in various states of the US as we speak. I was watching it on the news yesterday. So if you look at countries like China and South Korea, and then you compare it to countries like the US and the UK, the latter are countries where in the recent past, successive governments have severely underfunded their health systems for a variety of complex political reasons, but that is the reality. And now in the US, for instance, from what my medical friends tell me, it's quite clear that their primary healthcare system at the community local level is quite poor. they depend on the tertiary level healthcare system, i.e. the hospitals, to safeguard the health of their population. Whereas from what is beginning to emerge in the context of a pandemic, a public health system based on the preventive model is vital. And this is what Sri Lanka has, because at the local level here, we have PHIs, MOH, midwives, maternity clinics, etc., which have in the last 70 odd years ensured that the hospital system is not overwhelmed. And I think this has stood us in very good stead at the moment. Again, if you compare the countries like China with the US and UK, now they have tried to balance the needs of the economy and civil liberties with the health needs. And I think it seems fairly clear that this has not worked out. I mean, clearly these are three elements. It's very difficult to balance. It's, I think, a matter of getting the emphasis right. And what seems to work is a democratic framework which nevertheless provides the space for the curtailment of civil liberties in a crisis situation.
You use the word curtailment.
Yes.
Yeah, I like to kind of, I don't know whether I agree with you on that, because, I mean, are you thinking of looking at community needs, the needs of the society over the individual? Are you coming from that?
Well, I'm talking about it more in terms of in democracies, the constitution gives individuals various freedoms and rights vis-a-vis the state. Freedom of expression, freedom of association, and so on and so forth. Freedom to move about freely. Now, in a situation like this health crisis, what's become very clear when you look at countries like the US and UK is that their system of lockdown, where people are asked to not get about too much, only get about for essential needs such as grocery shopping or pharmacy or whatever. Now that really hasn't worked because those countries have community transmission. Whereas in Sri Lanka and New Zealand, which now we have had a more extreme form in that we've had a curfew. Whereas I don't think New Zealand actually had a curfew, but they have had far more stringent measures than either the US or the UK. So that is a sense in which I mean that individuals, there has been, certainly in Sri Lanka, a curtailment of civil liberties. And I think that was necessary because ours is a culture which is very community oriented.
That's right.
So if we didn't have that, if we had just had a lockdown, and people are asked to, not get about, I honestly don't, and from all that the medical professionals say, I don't think that would have worked out because we are at the stage of what the WHO has four stages in a pandemic. We are still at 3A, which is home cluster. Whereas we would have got to the community stage, and that would have totally overwhelmed our health system.
But also, I mean, I just like to put to you now, our health system, our PHIs, our people at the ground level, they are kind of used to this entire carrying out this campaign against the dengue. Not epidemics, more. So they are, I think they are equipped to kind of go to homes, check on them.
Absolutely.
And also, I see in Italy, what you said, Sunari, I think it goes well with what I have read recently. One of the reasons they say that COVID-19 spread very rapidly in Italy was that they were not equipped to provide some kind of like community health services. They are equipped.
I think that is a feature of the Western world.
Yeah.
Their health services are far more, as one of my doctor friends was telling me, they focus on the tertiary level, which is the hospitals, where the advanced technology, all that comes into it. Whereas in a pandemic situation, the labor-intensive kind of community-level health practices that we have is really what counts. Now, in all these countries, I don't think they have that level of, I mean, at the local village level, when I was doing my field work in Dodandua, I saw this, the number of PHIs, the maternity clinics, the midwives. There's a whole series of preventive programs such that and also there is an aspect that in our country, we don't only have the Western medical system, we have Ayurveda, which from all I hear is the IDH is using various Ayurvedic remedies in treating the COVID-19 patients. I don't know if you've seen it. The patient number.
Good point that you brought out. I think I have to, in my next interview, I think I should ask one of the medical practitioners to research a little bit more about this. And
absolutely.
Interesting piece of information that we could share with the public.
Because the Jayanta Ranasinghe, who is the first Sri Lankan patient, has put a clip on YouTube detailing his whole experience. And he mentions how he was given coriander, candor, inhalations, various Ayurvedic measures, which they are obviously using to cure our COVID patients. So you can see how, you know, the West and East are being combined in a very productive sort of way. I mean, I think that's probably what all that I have to say as far as the.
Do you think that our people will get more disciplined? You know, this morning I was having a long chat with a CEO of a production firm, and he was talking about, you know, that the post-corona factory flow will have to be completely different. We have to look at the CCP standards. We have to look at ISO standards. You know, the way production methodologies may have to change. We have to bring in robotics. You know, we have to invest in, you know, more automation, and that's something that we may not be able to kind of overlook
immediately.
But when it comes to general behavior, you know, we are not a society that, you know, that go around wearing masks. I see people just wearing handkerchiefs around there, you know, covering the faces. So that discipline and that, I think there's a huge role to play with regard to communication. You know, communicating behavioral changes to people, and also taking on a different form of activity, the way we behave, the way we go to work, all that may have to change.
Yes, of course, the state and the private sector has a large role to play in leading that kind of change. Of course, change, if you look historically, has always, you have to sort of feed in to the pulse of the population. There is only a certain extent to which you can lead. But I think this is a time when, as you say, there is a lot of change in the air. But that kind of, I suppose, brings me to the next question that you asked, which is there potentially a new form of social interactions in a post-COVID world? And would this change the way that we relate to each other and the environment?
Particularly the environment, Yes.
Yes, I mean, it's been amazing the way you see the air pollution levels going down, and so many things of that sort given this last month. so this is a health disaster of unprecedented proportions, certainly not seen in our lifetime. And this has implications for all other spheres of activity. There's an impact on resource generation, an impact on the worldview of this country, in terms of the imagining of the future, in terms of aspirations, especially in the context of a fairly new political regime. Because after the presidential election in November, there was a certain sort of national worldview that to some extent has got halted, if you like, at this moment. As an anthropologist, I see the social world as a series of social processes where individuals and households strategize to realize their aspirations using the resources, the networks, and the relationships at their disposal. And this kind of strategizing has several implications. It's done through the avenues that society offers, that is through its institutions and through the normative system which operates on these institutions. And of course, strategizing involves decision making and behavior, which is very much a cultural capacity. For instance, Sri Lanka is a country with a strong emphasis on welfare, unlike the US, for instance.
I guess that is what has, because of that emphasis only, that as you said, as you pointed out, that is one of the reasons why Sri Lanka is faring better than some of the
yes, because historically there has been a huge pressure on the politicians, the whole political system from the local level for welfare. And it's also, Sri Lanka is a country where behavior oriented towards the greater good of the community is very much the norm, coming from the temples, the churches, the mosques, and so on and so forth, except perhaps in urban centers like Colombo, which is after all a small percentage of the population. So I think what is happening now is that there is a process of adaptation to loss, revenue, resources, various things we have experienced loss. And there is a process of reconstruction. For instance, as you can observe various social phenomena, such as creative strategizing to obtain resources. For instance, the rupees 5,000 given by the state. There's a kind of hyper community consciousness in terms of the awareness that the nature of this health emergency means that individual action can have tremendous repercussions on the community. Yeah. One person's careless actions can infect a whole series of people. If you remember in Palmadulla, 67 people had to be sent for quarantine because of that one person who had, behaved rather irresponsibly. So I think there's been community cohesion, but also some levels of community division in terms of people's perceived self-interest. But as you mentioned a little while ago, I think Sri Lanka's community-oriented focus has been mobilized to deal with this crisis far more than in Western countries, where their model is far more a kind of individualistic model of social relations. I mean, I don't know if you saw on the news, the army taking pensioners from their homes to the banks to get their pensions and then taking them back. Now, I haven't seen that in any other country.
That's right.
So, I mean, it is obviously early stages yet, but I don't know that I would say that this is a social event of an order to foster a whole new form of social interaction in the post-COVID world. There will be changes. Generally, that sort of social change takes place when there is a significant external force which has an effect on the social processes of a community. I think there will be, as you say, adaptations, modifications in the manner that people work. For instance, in factories, officers, there might be far more people working from home where they don't have to go to office, but a lot of it can take place on the internet, meetings through Zoom and so on and so forth.
For instance,
so it is,
we at Marg have been working from home from 16th of last month, even before
the curfew was right.
We decided to close down, and work from home.
And also, Sri Lanka is we are a small country in that sense, and there are, our tea production has gone on. Our farming has continued even through the curfew. So there are certain social processes that have continued. So I don't really see that this is going to be a huge change as far as our norms, our institutions, people's aspirations for the future. Or decision making or behavior, kind of, the building blocks of social interaction. I think it will be more a process of adapting to new requirements, particularly the health guidelines. But I don't see the social world in that sense. Though obviously for the next year or so, certainly until a vaccine is found, every social distancing will be definitely the norm. But it's interesting to see how events unfold. Of course, in countries like the US and UK, where it's far more on a kind of, the crisis is on a much larger scale. It will be really interesting to see whether what kind of electoral pressure there will be on the political establishment in terms of healthcare. Because I think that is a huge problem in the US, kind of, workers in supermarkets, in factories and so on, who have really no insurance or, any kind of...
If you don't have medical insurance, you're so vulnerable.
Absolutely.
We have to be very thankful because it can just, walk into the OPD or
absolutely.
And get be treated.
Here we have the confidence that even if we get the virus, we will be taken to the IDH, and given the very low number of deaths, you can be fairly confident that you will recover and come home. Whereas if, in the US or UK, and I have heard stories where in the UK, and basically there you are told, don't come to hospital, stay at home for the first 7 days. It is only if your symptoms become really severe that you're, taken to hospital.
It is same in UK as well. One of our relatives had the symptoms, and she's a very elderly person. She was told to stay at home. See how it transpires,
Pans out,
And then, of course, she has recovered, thank God she has recovered. But but her whole family was in so much of anxiety.
Absolutely, it's a very scary situation if you are in one of those countries. I have a friend in Melbourne. She and her husband got it, but it's the same scenario. They were at home and they recovered, luckily. But and especially people who live alone, the idea of dying alone in your apartment or whatever, it's just horrendous from a,
I'm going to ask a question that we didn't plan for. I hope you don't mind, right?
No, that's fine.
Yesterday I took part in a survey. I think it was sent by one of the universities, and one of the last questions, I think the last questions that was asked was, within the next 1 year, after the curfew is lifted, within the next 1 year, what is the possibility of me visiting my friends and my relatives, whether it is highly probable or not probable. And I took some time to answer that question because I really didn't know, right?
Yes.
Whether I would, what my social interaction would be. Because as we see here, you and I are talking through Zoom. I'm working
Yeah.
through Zoom, through Skype business, through, MS Teams.
WhatsApp.
Martha is doing one of the, our major assignments with UNDP. We are connected online, and
Yes.
tomorrow we are conducting a training program
Right.
agency, and we are conducting this whole thing online. So
yeah,
again, the question arises: okay, what do you mean by social interaction?
yes, of
Be
course.
physical, face to face. Can it be
Yeah.
like this? Will our social interaction, kind of reduced to a very kind of say a single dimensional, very narrow type of thing, where we look for time, we look how long we are taking, okay, how much data do I have to carry on this
Yeah.
conversation. So
Yeah.
whilst we are being close to our community now, in our neighborhood, we are very close to each other.
Yeah.
We are on WhatsApp all the time, but
Yeah.
it's virtual, right?
Yes.
It's short messages. We don't have that time to express our feelings, express our views about something. Can't spend a lot of time. So
Yeah.
that's why I'm particularly interested in your response of how do you see the world, human interaction. Now, even in Sri Lanka, my domestic aide hardly got WhatsApp or Viber on her phone, and she looked at her
Yeah.
grandchildren and all that because she doesn't know when she could go back to Mahayana.
Yeah.
So, will our interaction become very brief and matter of fact, sort of?
I think that it's very difficult to generalize about that. I mean, for a country or I think that will depend from social microcosm to social microcosm. There will be changes. People's access to technology, and also because I have been observing, while, as you say, there is a lot of virtual activity, there's also people who are taking the opportunity to sort of leave their phones aside for a day, and especially while being in the house, pursue other kind of pre-technology activities. So I'd say that there's both things happening. There is an increase in the use of technology, but there's also people who are kind of feeling that they want to go back to a more rustic, if I can use that word, a simpler lifestyle, where the constant interaction with the laptop or the phone or the iPad, people are beginning to, and I think that ties in with the issue about the environment and the sense in which several people have told me that they think this virus is a way of the earth telling us, I've had enough, I need a break. And this month was, with air pollution, animals coming out, so many, in a way, the earth has rejuvenated itself a little. So, I mean, these are, of course, big capital has a strong role to play in this. What kind of, their if you like, the sense in which they lead the environmental aspect. another interesting point is what will happen with the airline industry. Whether if some of the airlines go out of business, as is being predicted, how much flying we will do. And that will also have a big impact on levels of social interaction across the continents. That's another, it's very difficult to predict as such at this point, because everything's kind of, up in the air at the moment, but lots of issues for research. That's since research is my favorite thing, that's the way I see it.
How people look at development, how people look, whether people take a fresh look at their aspirations and what they want in life. Yeah.
Absolutely.
But then again, I tend to believe, you see, 100 years ago, we had this Spanish flu.
The Spanish flu pandemic.
And then we had the Second World War, the Depression. And I was looking at, it was a couple of days ago, I was looking at the models of cars that came out after the Depression. I mean, people went back to, what you call, back to affluent living. Or I wouldn't say back to, but actually they took a step forward. And out came the huge Cadillacs and the Buicks, and and
absolutely.
I saw a very kind of affluent period in the West.
Yeah.
So I do not know.
Yes, human nature being what it is, aspirations are always there.
Yeah.
So I would be very surprised if we sort of wholesale go back to a simpler life and eschew all technology and that kind of thing. But I think there are pockets of, even in Colombo, people not wanting to shop at supermarkets, but going back to the small timers, like the vegetable, we've been having vegetables delivered by a lady, that kind of thing. So it will be really interesting, because many of these small timers were pushed out of business by the supermarkets gaining currency. But there seems to be a bit of a flourishing now of the,
Anyway, thank you very much, Sunari, for joining me and, having this little chat. It was quite interesting. It was a pleasure to connect with you. Hope everything will be okay. Stay safe, stay indoors. Wish you all the best. And let's hope that we could, get back to our work, get back to the normal, I should say. I don't know whether there will be a new normal or new.
Yes, I think.
At least for some time. And let's hope that we will be, by the grace of God, that we will be, protected, and Sri Lanka will come out of it well. Thank you.
Absolutely. Thanks very much for having me, Amma.
Bye. Bye.